This is a video on sterile dressing change. To start with, you're going to have to make sure you've got your appropriate supplies. I have a pair of sterile gloves. I have 5 packages of gauze. I determined the need for 5 packages of gauze on a previous assessment. I have a combine or ABD pad. I have a pair of non-sterile gloves. I have tape, and I have my cleansing solution that was ordered by the physician. So I'm going to start this procedure by first of all removing my old dressing. Notice that in relationship to my body, everything is waist high, and that is because as I prepare a sterile field, everything needs to remain at my waist high or higher. So I also need to be cognizant of the fact that everything has to be within my peripheral vision. In other words, if I turn my back on this wound, once I have exposed the incision, I cannot guarantee that nothing came in contact with the incision, thus contaminating it. So I've got my non-sterile gloves. I've got everything positioned the way I need it. I've already done the various assessments that will be discussed during your course. I'm taking up the dressing, taking care not to touch the actual incision. And as we learned in gloving, I'm going to take my dominant glove, wrap this up, come up underneath, and dispose of it in the appropriate receptacle. Now the wound is exposed, so from this point forward, it must not ever leave my peripheral vision, or at least my forward vision. So I'm going to start preparing my sterile field. And as we've already learned, you need to step back from your sterile field. You don't need to be over your sterile field. So I've got a receptacle in front of me, and that kind of helps me to remember not to lean over my sterile field, because this is going to be my sterile field. So I'm going to open the gloves. As we already learned how to open a sterile gloving package, I'm going to come under the tabs. I'm keeping my fingers only on the border. I'm also making sure that my hands and my body do not reach over my sterile field. So I have my sterile field ready to go, and I'm going to add to my sterile field. I'm going to take my gauze packages. I'm going to walk down the insides of my package. I'm going to put one finger on the outside of the package so that I'm not contaminating the contents. I'm going to use my fingers and push them into my gauze like such. I'm going to carefully tear the gauze down the sides, like such. And now I'm going to create a sterile sleeve so that when I add this gauze to my field, my bare arm, which is obviously not sterile, will not contaminate my field. I'm going to aim for my non-dominant glove. So I'm going to let go with the fingers that are pinching the gauze, keeping the index finger on top so that my package will not flop over onto my field. I'm going to dispose of it. The order in which you set up your field is up to you. I've removed the old dressing. When I get through preparing my sterile field, I'm going to lip my bottle. If you choose to lip your bottle ahead of time, that is your call. So again, I'm taking the fingers of my non-dominant hand. My index finger is on the top. My other hand is like such, and I'm pushing the gauze into this hand. I'm walking down the sides of my gauze package, taking care not to be over my sterile field, over my wound, and not below my waist. Creating my sterile sleeve. I'm going to drop the contents onto the field, controlling my package so that it does not fall. Now I have an extra pack of gauze. I said I had 5 gauze packages. Each package of gauze contains 2 gauzes within. The 5th one's going to be my spare, so I'm not going to open the 5th package. Fingers, index finger, fingers. Push into. Open. Envelop my arm. Add to my field. Notice I'm taking care to make sure I'm staying within the sterile area, though if it touched the border, it would not be considered sterile. I'm staying on the outside surface of the package, grabbing, opening, and adding. I now have 4 packages of gauze open. That will give me 8 gauzes, and that's what I need. The sterile combine pad, we can open at the end, and we will demonstrate how to do that. Now before I put on my sterile gloves, I want to make sure that I'm done with everything I can do with my bare hands, and that would include tearing the tape. So we're going to find a place on the tape. Prior to doing this, like you would with any sterile field, I've made sure that my table was clean, including the borders. So I'm going to put the tape on the border since I have cleaned the border, disinfected the borders. I've approximated the length of tape I need based on the previous dressing that was on the wound. And then I'm going to tear one additional piece of tape on which I'm going to put my initials, date, and time, so that whoever comes behind me knows when this dressing change took place. One final thing I need to do before I put on sterile gloves, and notice whenever I'm retrieving any objects, I'm not crossing over my field. I'm circumventing the field, okay? Because this exterior is not sterile, I can't let it cross over my sterile field. I'm going to take the lid off the bottle. I'm going to put the lid up because the inner surface of this is considered sterile. So I'm going to lay this to the side. I also chose my non-dominant side to place my items that I'm going to be using with my hand that will soon become contaminated. I'm going to take my bottle, I'm going to pour over the trash can above my waist, and I lip. I held the bottle by the label side. We do that for two reasons. Number one, we don't want any solution to drain over it, distorting the label so that the person behind you does not know exactly what contents are contained. Number two, when you lip a bottle, it is impossible to make your wrist do a 360-degree turn. So we need to make sure that the surface that is lipped is the consistent surface so that we know which pathogens, where the bottle is going to be considered clean. And again, as I'm adding this back to my table, I'm making sure I'm not reaching over my sterile field. So one more time, I'm going to assess my environment before I put on my gloves, because once I put on my gloves, I'm confined to sterile procedures from that point forward. So I know I can do this later. My wound is ready, my solution is ready, and my gloves are ready. So now I'm going to put on my sterile gloves. Again, I'm staying back from my sterile field. As a reminder, I'm going to grab the cuff. I'm not going to touch the paper. I'm going to pick the glove up. I'm going to step back. And I'm going to take my time. Don't be in a hurry when you put your gloves on. It's just going to make life difficult. So pull on the glove. Now I have a sterile glove. Now that I have a sterile hand, I can manipulate the environment in my field. Remember, I can touch the border. So I'm going to take my gauzes and I'm going to start separating them, moving them to the side because they're in my way. But I'm staying within my borders. I'm going to put on that second glove. Remember, I scoot my fingers up, envelop them inside the cuff. I'm going to say up, I'm going to say up, and I'm going to say away. And I'm going to put my glove on. Don't panic if your fingers won't go in the right way the first time. You can fix this, okay? That's the beauty of having a sterile glove on, okay? So I'm ready. Looking around, I need to prepare my field. I'm going to separate my gauzes. I know I need 2 for the length of the dressing. The incision itself, fold 2 in half, and notice that I'm not over my field other than with my sterile gloves. Now, you can create your gauze for cleaning the way you want. If you want to make what we call poofies, you can do that. I'm going to make both. I'm going to do what we call poofies and what we call wontons. So I'm going to make both so that you can see, you choose whichever works best for you. You see that I'm being very careful not to lose my peripheral view of my incision and that I'm not standing over my field. So I have these, and then I'll show you, we'll do the what we call wontons for the drawing part, and you'll see the difference. Okay, and so I'm assessing, and I'm looking one more time. Am I ready? Because I'm about to contaminate one of my sterile hands, and I'm going to use my non-dominant hand. I'm going to come around my field, and I'm going to grab the label, my palm the label. This hand is now considered contaminated. I cannot use it for any sterile part of the procedure anymore. With my sterile hand, I'm going to grab one of my cleansing cloths, one of my poofies, and notice that I have extended the gauze beyond the length of my fingers so that my fingers won't accidentally touch this patient's skin and thus contaminating my glove. I'm going to pour some of the solution. I'm not going to let the bottle contact the gauze. Even though I've lipped this, the chance that it catches the ring or whatever would result in contamination. I'm going to squeeze out excess, extend my fingers, and at this point I need to determine what am I going to clean first. Well, the incision is always the first thing we're going to clean. We're always going to go from the distal to the proximal. Just imagine the patient in an upright position. Which way are pathogens going to travel? They're going to travel down. So therefore I want to travel in that manner. So I'm going to start with this end of the incision, and in one clean swipe, making sure my fingers don't touch the patient, I'm going to come downward, pick up, and I'm going to discard. Now, looking at this incision, both sides of the patient are equally dirty, if you will. If this was near a pubic area, the pubic side would be considered the dirty side, therefore I would clean it last. However, since these are both equally dirty, I'm going to do the distal to proximal clean technique. I'm going to tap at my solution, extend my fingers, come around, one nice sweep down the side, watching my gloved hand and watching that this hand is not reaching over my field. I'm ready for the final side to clean. extend, and down, and discard. Now at this point, I'm going to be ready to dry. It is up to you if you want to keep this in your hand at all times so that you won't forget that this hand is contaminated, or if you want to do like I do, I'm not going over my field. I'm going to lay the bottle down and I'm going to put this hand behind my back. And now I'm going to make what we call wontons, and you can do, it does not matter what you use. And all I do is take one corner, one corner, one corner, one corner, okay? And again, same principle. I've made sure that my gloves are protected because as I tap this dry, I'm going to pat going in one direction, careful not to backtrack, and dispose. Never use a gauze more than for one motion. Corner, corner, tap, 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 and drop. My gauze, tap, 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 and drop. And now I'm ready to apply the actual initial dressing. And I'm going to pinch it up in the middle and drop it. And I'll show you why in just a moment, why I'm pinching it this way. And again, I'm going to start in the same direction we talked about, from the top to the bottom. If I were to pick up the dressing this way, when I lie this on the patient, there's no guarantee that my fingers did not touch the wound, therefore contaminating my gloves and potentially the incision itself. So we pinch in the middle and we drop it. At this point, the wound is covered. Now I can use both hands. So I'm going to take my ABD pad, I'm going to take it out, and I'm looking at the blue line. That is the surface that's going to be on the exterior. Therefore, I can touch it. And I'm going to open it like this, maintaining the sterility of the inner surface that is going to contact the wound. And I'm going to lay this on my patient. And then I'm going to apply my tape. Never, ever contact a wound without some form of glove on. Remember, your standard precautions dictate that anytime there's a reasonable chance that you will contaminate your hands, you need to have gloves on. So I'm going to leave my gloves on, which is why we tore the tape in advance, because it's very difficult to do. And I'm going to tape this, and if it depends on the type of wound, if it's an occlusive or non-occlusive, whatever your physician's ordered, etc. I'll tape this down. The whole time I've been doing this procedure, I've been monitoring my patient's response. Is it a very painful procedure? Are they comfortable? Are they anxious, frightened? Whatever I may need to address. And then I've got the piece of tape that had my date, time, and initials. I'm going to put that on there. I can remove my gloves. And watching that I'm not contaminating, and positioning my patient for comfort and privacy.